Dysport is a prescription medication containing botulinum toxin type A as the active ingredient. It is a purified neurotoxin derived from Clostridium botulinum bacteria. Dysport is used for its neuromuscular blocking properties to temporarily relax specific muscles and reduce the appearance of wrinkles or treat certain medical conditions. Indications. Dysport is indicated for the temporary improvement in the appearance of moderate to severe glabellar lines, frown lines between the eyebrows in adults. Dysport is also used for the treatment of certain medical conditions such as cervical dystonia, spasmodic torticollis, muscle spasms, and excessive sweating, hyperhidrosis. How to use. Dysport is administered via intramuscular injection. The injection sites and technique are determined based on the specific indication and the location of the target muscles. The injection should be performed by a trained healthcare professional with experience in administering botulinum toxin injections. The dosage of Dysport is individualized based on the specific indication, severity of the condition, and the patient's response to treatment. For cosmetic use, the recommended dose for the treatment of glabellar lines is 50 units administered as a single injection, divided into 5 injection sites, 10 units each into the muscles between and above the eyebrows. For medical use, the dosage and injection technique vary depending on the condition being treated and should be determined by a qualified healthcare provider. Contraindications. Dysport is contraindicated in individuals with hypersensitivity or allergy to botulinum toxin type A or any components of the formulation, infection at the injection site, neuromuscular disorders such as myasthenia gravis or Lambert-Eaton syndrome. Special instructions. Prior to treatment, patients should undergo a thorough medical evaluation to assess suitability for Dysport injection and to discuss potential risks and benefits. Dysport should be administered using sterile technique and appropriate injection equipment by a trained healthcare professional. Injection sites and dosage should be carefully selected to achieve optimal results while minimizing the risk of adverse effects. Side effects. Common side effects of Dysport injection may include injection site reactions such as pain, redness, swelling or bruising, headache, temporary dropping, ptosis, muscle weakness or stiffness, flu-like symptoms. Serious side effects such as allergic reactions, difficulty breathing or swallowing, and spread of toxin effects beyond the injection site are rare but may occur. Patients should seek immediate medical attention if they experience any unexpected or severe side effects.